Think Forward. Think Research Channel.
Great Conversations features prominent members of our world-class faculty engaged in compelling conversations with influential thinkers from around the globe. In today's fast-paced world, finding a reliable source of information for understanding complicated issues is a challenge. But audiences come to Great Conversations knowing that they'll hear thought-provoking analysis directly from the people at the center of the most complex and compelling issues of our time. Since its inception in 2002, we've met legendary individuals who have challenged conventional thinking, conducted groundbreaking medical research, resisted repressive regimes, and worked to preserve the world's fragile ecosystems. From artists and environmentalists to inventors and scientists, these fascinating discussions have demonstrated time and time again that the courageous actions of one committed individual can change the course of history. But Great Conversations is more than a celebration of the actions of a few fearless individuals. It's also a source of inspiration for our audiences. Armed with firsthand insights and informed analysis, they routinely come away energized, moved, and committed to make their own mark on the world. So won't you please join us for a great conversation? We'll save you a front row seat.
Thank you, Dean Nichols. Doris, I'd love to have a conversation with you pretty much any time, any place, about almost anything. But it's a particular honor and privilege to be here at the TED Man and talk with other people around us. Just a month ago, there was a conversation on this stage. Vice President Mondale and the famous journalist Seymour Hersh were interviewed by Professor Larry Jacobs, and it was an outstanding evening. A couple weeks later, I was back at the TED Man, and one of my favorite celebrities, maybe my favorite celebrity, Lynn Rosetta Casper, was the diva performing with the Twin Cities Men's Gay Chorus. That was a night to remember, too. And here we are. I thought, how are we going to, kind of bring it up to that level of interest? I thought, well, we could put on our tap shoes, announce that Franken and Coleman had said they'll step aside if you'll be in the Senate. And then we'll invite everybody over for dinner.
There you go.
Does that work? It's just so wonderful to get to be with you this evening. As I started imagining our conversation, my image of it has been Oprah interviews Einstein. You're Oprah and I'm Einstein. You're Oprah, you're Einstein. I'm here to make sure people don't think you talk to yourself. Doris, there are three topics I'd like to get our heads together on to talk about tonight, and they're interrelated. In fact, each one defines the other two, and each is dependent on the other two. And the topics are these. I really want to understand and know more about your discovery, where you are now, and where you're headed. Something else I very much want to know, and I don't think you'll be able to get out of this one. I want to know more about you. I really love what you do, and you bring together two of the things that matter the most to me: highly disciplined, innovative science, and the creativity of the artist. So I want to know more about you.
Oh.
And then I'd like to move us into talking about the future, because I like the looks of the future you're taking us to.
Absolutely.
Great. So could you just describe what your discoveries are and where you're going with them?
The first point I have to make is we're talking about my discovery as if I did this, but in truth, a team of people in my group did this. I just get to be able to talk about it. So let's be really clear that there's some people who lived, ate, and breathed this science over the last few years. And I'm here representing them, telling you about some pretty cool stuff that's happening here at the University of Minnesota.
Fair enough.
So, what did we do? Well, about 15 years ago, we decided that trying to treat heart disease with cells was the wave of the future. And if you think about it, what happens when you have a heart attack? You know this, a blood vessel gets clogged, and the cells in your heart downstream from that clot die. And when they die, your heart has no choice but to make a scar, just like any place else in your body where you have a big wound, if you will. So that scar can't beat anymore, and obviously beating matters in the heart. It's really funny because I was at Duke, and before I went to Duke, I didn't know basketball from anything. And so what I had to learn, I knew the heart, but I didn't know basketball. And at Duke, the only place where we viewed basketball as bad was the heart. Because if your heart looks like a basketball, it can't pump blood. And football is good. Well, Duke didn't have a football team, so we didn't mention that much. But we talked about how we really wanted to take this heart that looked like a big, round basketball that was called heart failure and basically make it look like a football again so it could pump blood. And the only way we could think of to do that was to grow new muscle in that scar. And it made sense to us to use cells from your own body to try to do that. So we did. Well, that's actually moved forward, and there are probably 2,000 people now that have been enrolled in clinical trials around the world trying to use your own stem cells or cells from your body to treat a heart attack. But there are 22 million people living with heart failure. And for those people, cells may not be enough. And the only real cure, as you know, is a heart transplant. So we said, for those people who need a heart transplant or a kidney transplant or a liver transplant, what the heck, let's try to build them a heart or a liver or a kidney. And we know that it takes three things to build a tissue. It takes cells, but obviously cells aren't enough. It takes blood vessels for those cells, because you got to feed them. What causes a heart attack in the first place? The blood vessel gets clogged up. And it takes a scaffold, a place to put those cells so they look like a heart, act like a heart, talk like a heart, if you will. And we said, wouldn't it be cool if we could take somebody's sick heart and remove all the cells and put healthy cells back in? So we gave it a try. And one of the things that I brought tonight, so you can see it, is one of those hearts. This is a pig heart where we literally removed all the cells. And you can see it looks a little bit like Jell-O, if you will. It's wiggly, but it looks like a heart too. It's got all the pieces of a heart, the part that pumps blood, the ventricles, the atria, the blood vessels, and we took something that looked like this, literally, that was dead, in a jar, transplanted cells back in, and 8 days later, eureka, we had something in the lab that beat like a heart. And I think we have a video that we can actually show you of that beating heart. And I have to tell you, the first time we saw that heart beat was one of those yes moments in life.
Doris, this is actually kind of beautiful.
It is. It's gorgeous, isn't it? You can tell we're both geeks, but that's a different issue.
It is stunningly beautiful. But where I have a big understanding gap, maybe imagination gap, is seeing how you can take a different group of cells, populate this tissue, and have them start doing those things. How do they beat? How do they conduct?
So what's a stem cell? A stem cell is a cell that can do two things. Can make more of itself, or self-renew, and it can differentiate into or become a number of different kinds of tissues. So our idea was that we could take immature cells, put them in an environment where they think they're a heart, and if we treat them like a heart, we give them an artificial blood pressure, we give them a pacemaker, we give them all the things they need, a blood pressure, then they'll start to think that they're in a heart, and they'll start behaving like a heart. And sure enough, after a couple of days, we saw these little tiny contractions. And a couple days later, a little bit stronger, and by 8 days, we had something that we could actually see beat. It was remarkable.
I'd like to see the clip. Can we get it?
We can try, and look at that. 8 days after and you can see on my right, on the right-hand side of the heart, it's a little more opaque, a little denser than it is on the left-hand side, because we put cells just in the left ventricle so we could see what the right-hand side looks like. Look at that. See the pacing wires hooked up? I have the Medtronic Bakken chair. We had to use a pacemaker, you know. No, no, really. The really cool thing is we had to teach this heart how to beat. So we hooked a pacemaker up to teach the cells to beat together. And they will. We can take heart cells, I have to tell you. You can take heart cells, put them in a dish, and they'll beat. And when you see cells in a dish beat, it's pretty creepy the first time it happens.
I think so. I would think so.
It's also pretty remarkable because you go, wow, what is life?
Yeah.
What is life? I'm not really sure anymore. And then, but cells beating in a dish don't make a heart. If they did, we would have cured heart disease a long time ago.
Right.
So putting them back in this environment means that we can begin to do that. And, you know, the heart in many ways made sense to us because it's simple, but it's just one organ. And the beautiful, remarkable thing is we can do this with any organ. Because I am a geek, this is a kidney.
That's gorgeous too.
It's a kidney. It's a pig kidney, and it shows that if it gets a blood supply, we can build it. We can build a kidney, we can build a liver, we can build a lung, we can build a pancreas.
You know, you started out saying that you took dead heart muscle, and with the stem cells we are able to imagine and getting to the point where you create living heart muscle.
Right.
And now you're talking about kidney.
Right.
You mentioned the liver.
Right.
Are we talking about something that's a little beyond just dealing with scar and maybe
Oh,
dealing with natural?
Absolutely.
Okay.
We're building livers in the lab now. We're building hearts in the lab now. We have people come visit us in the lab, and I would invite anyone here who wants to come see what we do. People come in the lab and they see this heart sitting there beating, and they're just dumbstruck like I was. It's so much fun. At the same time, you know, you can't grow up in Mississippi like I did in the time frame that I did and not want to change the world. And I believe we can change the world. I believe we can change the world for people with disease. I believe we can change the future of medicine. And I also believe that that won't always be popular.
I think this is where you're coming to admit that you're an outlier. Because I don't think everybody in our field, in bioscience and medicine, really believes we can have dramatic impact.
Right.
I think sometimes it is, how do I get this patient through this day?
Sure.
How do I get this patient through this disease?
Absolutely.
How do I even take this big question I have and start formulating the research that will get to an answer? It's an intimidating task, and I think most people don't say, we can change the world. Let's get to work. So why are you different? What makes you think, Doris Taylor, that you can change the world?
Couple of things.
Okay.
Again, you can't grow up in Mississippi like I did when I did and not believe that it's possible. It changed, and it's possible. I had a mom who was a single parent because my dad died when I was 6, who told us we could be or do anything we wanted to do. And there was no reason to think we couldn't. And then, you know, nature's really pretty simple. If you look at these flowers, they're gorgeous, they're beautiful. And actually, when I get depressed, sometimes I go sit outside in the grass or nature or look at some flowers, and I see the flowers and I go, these are perfect. They're perfect. And if they're perfect, then there's no reason for me to believe that we can't build something if we use nature's tools that's just as perfect. Now, could I figure out how to build this in the laboratory by myself? No. Could I say, I'm going to start from nothing and build a kidney? I couldn't. Fortunately, there's some engineers out there who know they can build whatever they want to build, and they're going to do that. But for me, what the heck? Nature's done it for us. Let's take advantage of nature's tools and get out of the way.
Doris, this is where I see a difference between most of what happens in medicine, and I'm including biomedical research, and what you're saying. And that is, it seems to me, so much of what we do in the clinical setting, in the research setting, is figure out how to defeat nature, to overcome nature, to do it differently than nature would have it go.
And we haven't cured a whole lot of people of most diseases either, have we?
Correct.
You know, I actually believe, if you think about it, our bodies know how to heal themselves. I have this saying, and I have a slide that I show, first slide in every talk I give, that says aging is a failure of stem cells. and if you think about it, when you're 2 and you hurt yourself, you break, even if you break your leg, you're not debilitated for the rest of your life. In fact, you're up running around in a few weeks. And you fall down, you scrape your knee, you don't have a scar. Well, by the time you're 32, 42, 52, 62, you fall down, you probably are going to be damaged to some degree for the rest of your life. Why is that? Because you no longer can repair your body to the same degree that you could when you're 2.
I think it's part of why I started in pediatrics. You know, children are stem cells with runny noses.
Absolutely. Actually, they're incubators with runny noses,
that's true.
but that's a different.
But
They're little stem cell incubators.
But something happened more than growing up in Mississippi, because you have still moved into a niche in the world that not many people occupy. And I appreciate, and I believe you. Your work reflects the work, the creative work and hard work of many people. You didn't get there alone. Right. But I want to know some of those influences that led you on a path of discovery like this, because a lot of people do medical research, but don't end up with breakthrough discovery.
Well, a couple things. I'm lucky. I also had a lot of people tell me I couldn't do it, and the last thing in the world you want to tell someone is they can't do it. Because then, you know, when we tried to get funding to do this, the reviewer said not possible. And if it is possible, it's certainly not possible from you guys because you're not tissue engineers. Right. And it was like, it was very nice to be able to say nah 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 nah. Yeah. You know, we did it. But truthfully, you know, this is a whole different topic, and we could talk about it all night. But I remember when I was a student, my very first semester in a lab, I remember my quote mentor at the time saying to me, "You're a woman, you belong at home." And he went so far as to say, "You belong at home in bed." Ooh. You know?
Yeah. I know. You know, that's...
You know, what can you say except
you move on, but some people...
You want to, once you hear that, once you see people who think that's small, it's easy to quit believing what they say. And once you quit believing what people say, you can make up your own world and do whatever you want, you know? I mean, really, why not?
But you said something that I've found myself using exactly the same gesture to say. So I'll just pick up briefly on this because I want to use this to catapult us to why it's going to work better. But you said mentor. And that's how I always say mentor. Because I think people of my generation didn't necessarily have the mentors or the role models that were going to take them down a path.
Right.
And you said, I heard you say earlier, women think they can change the world. Maybe it's because we aren't always following a well laid out path.
Right.
We have to find a different one. And sometimes that leads to the Doris Taylors.
Well, I certainly think that if you don't know what you can't do, you can do anything. And nobody told us what we could or couldn't do. They just basically, you know, oftentimes I think we've just gotten thrown into the fray. We're not privy to the conversations that we're talking about all the possibilities or impossibilities. And I've been really lucky that I haven't, you know, why did I take this position at the University of Minnesota?
Yeah.
In part because it was named after Earl Bakken, and I thought, okay, if any position in the world is going to give me the opportunity to think outside the box, certainly something named after Earl Bakken would.
Oh, that's good.
You know?
Let's pick up on that a little bit. I'll just share with you as we kind of leave this issue of mentors and expectations and what you can and can't do. My daughter once said to me when she was working hard to succeed in school, you are so lucky. Nobody ever had any expectations of you. So I think I'm starting to get it. Another little stem cell makes a point.
That's right.
I'd like to pick up on something you just said, because you and I are both at the University of Minnesota, not just tonight, but for a substantial part of our life commitment.
Sure.
For you, it is your work, it is your passion. For me, it's my service and it's my passion. So we're both here at this university, and let's talk about some of the elements that make you said you came for one reason, Earl Bakken. Well, what keeps you here? What makes it work for you here? And then we'll move beyond the university.
You know, I said cell therapy is where I started, as I said. And when I got here, one of my goals was to try to build a cell therapy network so that we could really make ourselves known as an institution, as a group that treats cardiovascular disease with novel, innovative therapies. And I called a colleague at the Mayo Clinic, and I called a colleague across town, both of whom I knew a little bit before I came here, and I said, okay, guys, if we get together, nobody in the world can beat us. And it's true. And you know, one of the things that I think makes it possible to do what we do, or makes it possible for me to do what I do anyway, is I'm not afraid to work with other people if they want to change the world too. I'm not as good at working with people if they just want to take an incremental step forward. Sometimes we have this Gandhi quote on my office wall now, but it used to be on my office door at Duke, and it says, first they ignore you, then they laugh at you, then they fight you, then you win.
Yes.
Well, if somebody's not laughing at me, fighting me, or ignoring me, then I haven't done my job right for the day.
Oh.
So, and there are probably a lot of people at this university, they'll tell you they're usually fighting with me or laughing at me.
So this is a rich environment for that sort of I understand now.
No, in reality, There's an expertise here. When we're involved in cardiovascular cell therapy trials, we're in the National Heart, Lung, Blood Institute network. Nobody recruits more patients to those trials than Minnesota.
And there are reasons for that. That's on the backs of some incredible science.
Absolutely. The science, the collaborative relationships, the colleagues, the people who are willing to innovate here. Innovation is not a bad word here.
One of the things I love about the university is in medicine and biomedical science, you really see the bedside to the bench to the bedside. You see the question, you see the opportunity, the colleagues, the environment, where you can go for that answer when it's not in the book and when it's not in the room with you with the patient. And then, because of the richness, as you point out, of the resources at the university and this broader community, you can bring it back where it can do some good.
What's so much fun about all this is we're talking about the heart, and I've pointed out that we're talking about kidney, but you know, the things that we're learning about the heart and heart disease really apply so much more broadly. It's a snapshot into every kind of disease. And I made the comment earlier that I think aging is a failure of stem cells. Well, I'm not kidding when I say that I think if we can capitalize on our body's ability to heal itself, and we can, either by providing the right cells or providing the right molecules or providing the right stress reduction or foods or whatever it is, and we're looking at all of them, and we have the ability to do that here, if we can focus on those tools, we're not only going to change medicine, we're going to change aging, we're going to change disease, we're going to change people's ability to even be on the planet and be healthy and have a good quality of life. 10 years ago, if you got a mechanical device to prolong your life if you had heart failure, you almost wished you hadn't gotten that device because your life was so miserable. And the only reason you did it was because you wanted to live to see your kid graduate or you had some motivating factor in your life. Today, because people have been willing to say, this isn't good enough, I want more. And in large part in this state, people now live with those devices for years and are happy and live productive, high quality of life lives. I'm just taking it to the next generation.
Let's look at what's going to help get it there and what some of the things you're going to have to fight are to get it there. We talked about the university environment, and this is a particularly rich university environment. But look a little beyond our place, at our state, at our nation, and let's talk about what's going on both places and how it influences the type of research discovery and then ultimate translation to people's lives.
You know, you started the political conversation, so I'll just take us back there.
All right.
You mentioned, you know, when I came to the University of Minnesota 4 months after being here, there was a bill proposed at the state legislature, I don't know if you recall it, to defund the university because of the stem cell research that was underway at the university.
35 legislators signed that.
Right. And that bill was based on fear.
Right.
And it was based on misunderstanding. Well, you know, I went to multiple legislators and had conversations, barely even knew where the Capitol was, except that I could see it from where I live. But went and spoke with those legislators, and I had people say, absolutely change their mind based on the conversations we had. But more than that, I went to churches and I gave talks about stem cells. What's a stem cell? And when you educate people that, as I said earlier, a stem cell is just a cell. We all have 1 billion stem cells in our body. they're just cells that can really make more cells and become different things than we thought they could. We used to think the cells in our bone marrow could only become blood. Now we know they can become blood vessels and kidney and heart and you name it, they can probably become it. When people get the right information, they go, oh.
But there are a couple layers there. One is there is a lack amongst many of us about what a stem cell actually is.
Right.
You can correct that with facts.
Right.
Another is a lack of realizing the extraordinary potential in terms of improving lives.
Right.
Because some people started there, bless their hearts, and said, I see so much good that come out of this. Let me track back and see if I can justify doing the work. But then help us, because there's still controversy. And you haven't won over everybody.
Nope.
Nor do you need to.
Nope.
But there's still some barriers with concern about using stem cells because of their origin. You want to just speak a little bit to the different origin of stem cells and why it matters?
Sure. So the fear is all about, quote, embryonic stem cells. Now, we could have a different political conversation, and again, I'm going to show my, my kind of early 70s, late 60s upbringing and say if we'd called them fertilized egg stem cells, we'd probably be having a different conversation right now. That if we had named them something different and really described what they were, we might be having a different conversation. The fear from the misinformation, again, and the fear from many people is that we are aborting fetuses to derive these stem cells. That's simply not true. The science is that if you use a fetus to derive stem cells, they're too old to do what embryonic stem cells do.
They've already differentiated.
They've already gone too far down the path. So, what is an embryonic stem cell? It's a stem cell that's derived from a fertilized egg after it's divided about anywhere from 8 to 100 times. And it's a cell that still has the potential to become any organ or tissue in the body. Now, my personal belief is that embryonic stem cells are not yet ready for prime time because they do know how to become any organ or tissue, and we don't know how to fully control that yet. But what they can do is teach us how to build those organs, how to build those tissues. And my own personal belief is that just as I respect someone else's right not to believe that that's a viable choice, that I think I personally would be morally remiss if I didn't take advantage of every tool that's available to me to try to cure disease.
I think that's another sort of profound statement to hold on to, is sort of the moral imperative to do something, to do something positive that can help.
You know, it's really not that complicated. We keep coming back to that, but it's really not. Nature knows how to heal our bodies. We get in the way. And as we learn what those tools are, 10 years ago, 20 years ago, we didn't even know what a stem cell was. We didn't know that our bodies build new blood vessels all the time and our organs as they heal. We didn't know all this capability for repair. So we're really just catching up with those tools that nature has created.
You make it sound easy because you understand it so well and can help me understand it, and I hope other folks feel the same way. But it's sort of like Doris Taylor is going to have a show, This Old House. It's going to be This Old Heart, and you're going to tell us all how we can do these things. It's not that hard.
You're good at that.
Doris, before we kind of move on from your description of what a stem cell is and what it isn't, when you were busy in the lab in November, one day there was an election, and there's new administration in Washington, and I just wondered if that will make any difference in terms of maybe this particular leader or this administration or this nation, whatever it is, but in terms of our policies, attitudes on stem cell research, in terms of our funding.
Well, you know, again, when we were lucky enough to make this discovery last January, one of the presidential candidates at the time congratulated us, actually, it was really nice, and said, you know, there's been a war on science in this country. I actually thought that was a pretty interesting choice of words. But the reality is that funding for science is at the lowest that it's been in my lifetime. It used to be that if you submitted a grant to the National Institutes of Health, where many of us do, and a lot of people don't know this, but those grants are what keep the lights on to some degree in this and every university. But if you submitted a grant, you had a 1 in 4, 1 in 5 chance of getting that grant funded. Now, or prior to the election, it was 1 in 7, if at all. Some institutes didn't fund any grants last year, none.
I know, I've been in that 6 of the 7 at times, Doris.
And so it's horrible. Funding has been at the lowest that it has been in my lifetime. With the new administration and the stimulus package, there is grant money available because right now the administration and the country realizes that we've lost a whole generation of people who want to do science. Used to be that you applied for a job, you got a job at a university, and the expectation was that within 4 to 5 years you had a grant. And if you didn't have a grant, you were out. Well, you can't say, okay, the NIH is going to fund 0 grants, but you're out. And so all of a sudden, we've lost people who would have otherwise done very well.
I think that there were really 3 heartbreakers in this, for me, in our course we've had over recent years. And one was the losing of the scientists, losing of those opportunities for very talented people. We saw people steer away from biomedical science and research.
We also saw them go overseas.
Yes, we did, especially leaving our country or not being able to come here. Where some of our great talent has come from other countries as well, of course. Another thing, though, is that we drove some types of research into the private sector.
Absolutely.
And very good things happen in the private sector, but it's not open. The university, especially the public university, but anybody who gets federal funding, and that's a university, you're open to the scrutiny for your ethics, for the quality of your science, for the debate. I want the debate to be held here in the public about using stem cells, about
building organs.
About building organs.
Could you imagine if we weren't allowed to have a bioethical debate about whether or not you can build and sell an organ?
And the last thing is we want that to be done behind closed doors where there doesn't have to be the scrutiny, just the end result. We want it where the public can engage and help define what this country's going to do and this world's going to do. And I want to take you there. I want you to take me there. I want to go forward now. We've looked a little bit in Mississippi. That's enough. I had to hear about Duke basketball. That's enough. I'm assuming you came here because you're ready to move from learning about basketball to football.
Oh, there you go.
But I'd like to
I grew up in the South. I know football.
Oh, you would. You probably got to play. I would like to pick up on some points you've dropped here that I find to be little cherry bombs. You've moved from heart, and then there's kidney, and then there's liver. It's one thing to talk about a clogged blood vessel, that then the blood supply doesn't get to the heart, and so the muscle dies. But that is somewhat part, and some of the other conditions are really part of what we view as the natural aging process. Organs fail as part of aging. We don't entirely understand why that happens, but they do.
I can tell you why that happens.
Why don't you tell me why that happens, and then tell me why maybe it doesn't have to happen.
Like I said, most of our lives, our organs and tissues repair themselves. But ultimately, they run out of cells. And we have normal wear and tear that occurs all the time, whether it's one too many trip to McDonald's or one too many jogs around the block. We have damage to our organs and tissues, whether it's a car wreck, whether it's whatever. And the cells that are present in our body are what repair that. But we have a finite number of those. And if you think about it, look in an organ as it ages, and what do you see? You see fewer cells and more matrix. And you see what we call fibrosis and scarring. Well, what's fibrosis? Fibrosis is just more of this stuff and less of the cells, more of what we call the extracellular matrix. So I would argue, now I can't prove it yet, but I believe I ultimately will.
I know what to do at this point. I laugh at you, I fight you, and then we're going to have it. So I'm ready. Go ahead.
So ultimately, we think that fibrosis happens because you no longer have the right cells there, and instead you have the wrong cells there that are really pro-inflammatory. I actually think inflammation, fall down, scrape your knee, you have a red mark. It's inflammation. You have atherosclerosis or damage to your pancreas because you have diabetes. What do you have? You have inflammation. What is inflammation? Well, my simplistic view of the world is inflammation is nature's cue to say, send me stem cells, I've got an injury here, send me cells. And if you get the right cells there, you turn off the inflammation and you repair the damage. If you don't get the right cells there, your body goes, I said, send me cells, and inflammation gets ramped up. And then you get the wrong cells there, and you start damaging your own organs. And it explains why women, for example, who have a lot of inflammation develop autoimmune diseases, diseases where they're fighting their own tissues because they start getting the wrong cells there.
Well, I'm thinking in my own world because my special interest is in breast disorders in the young. And there's a natural progression. This will surprise people, but breasts change with age. They start out one way with a certain ratio of tissue types, and over time become much more just the architecture, the matrix, the fibrous. Breasts become increasingly fibrotic, and ultimately, if women live long enough, they will have breast cancer. Ultimately, we'll all, if we live long enough, have a cancer.
Can I tell you why I think that is? I really have this very simple view of the world. Stem cell colored glasses here. I admit it. I think some cancers are nature's attempt to replenish that stem cell pool. And it goes awry.
Ooh, I like that.
And if you think about it, if you're starting to run out and you try to ramp up dividing the ones you have left, if you have one mistake, wow. And we now know that metastases, at least some metastases, are stem cells.
Yes, indeed.
What's the difference between a tumor cell and a stem cell? A tumor cell is a cell that can make more of itself, and it can become several different things, new blood vessels, new tumor, new whatever. What's a stem cell? It's a cell that can make more of itself and become multiple different things.
Exactly as you say, there are tumors where it's very clear when they're in this certain environment, they are going to evolve in a direction. And something brought those cells, something flipped their switches to become what they are. They are trying to grow.
So I think not only can we reverse aging, we have data that show that that as you age, the number of stem cells in your blood decrease. And we know there's not our data, but data from other scientists in Boston say that stress ages your cells. Well, you know, if that's true, then the things that we do that relieve stress should help your stem cells. So can I tell you a really crazy, cool experiment we did?
Won't you please?
We drew blood. So with Mary Jo Kreitzer and the Center for Spirituality and Healing here, I had the opportunity to do a session with Mathieu Ricard, who is a Tibetan monk. We actually, in one anecdotal, non-scientific way, drew his blood before and after he meditated.
Ooh.
What we saw is that the number of stem cells in his blood after he meditated went up 40%. 15 minutes of meditation.
Wow.
Well, couple that with the fact that we can tell you which stem cells are good stem cells, which ones are bad cells, and we can start to draw a picture of health and a picture of disease and how to move you back and forth on that, whether it's give you the stem cells you need or teach you how to intervene with non-traditional foods, medicines, practices, approaches. What the heck? Let's cure disease.
Doris, I'm not sure, but I'd love to hear the answer to two parts of that maybe. How do you increase the supply of stem cells? I'd like to know in the body,
Sure.
and I'd like to know available to do the kind of research, discovery, and application.
Sure. Well, if you think about it, the first stem cells were really used here at the University of Minnesota. We talked today about the fact that the cells in our bone marrow are stem cells. The first stem cell transplants, bone marrow transplants, were done here at the University of Minnesota. So, you know, the off-the-cuff answer is you go to the bone marrow bank at in St. Paul and you get bone marrow and you grow stem cells. But the more serious answer is, I think as we learn about our body's ability to not only increase the number of cells that we have, but move the ones that we have from our bone marrow into our blood supply, that it really is about all the things that we've been told all our lives: exercise, good food, lower stress, et cetera, et cetera. And you know, if you don't think stress ages your cells, look at any president before and after they've been in office for 4 years. And I'm a firm believer that we can actually intervene and move you backwards on that continuum. And that's actually, we've got data that show we can reverse plaque buildup in blood vessels by delivering stem cells.
Can you take stem cells, or can you take cells at some point and de-differentiate back to stem cell?
Sure. There are people who are doing that. How does the cell know how old it is? It has a little piece of DNA on the end of the chromosome that gets shorter every time the cell divides. And it's called a telomere. And as it gets shorter, ultimately it reaches a point and says, I'm old, I guess I better die. Well, there is an enzyme that can actually make that DNA longer again. And so there are people who are doing, quote, gene therapy studies to put that enzyme back in cells and make the DNA longer again. I would argue that we don't have to do that some of these non-traditional interventions and the right environment will ramp up the enzyme that's already there in the cells and make the DNA longer. So, you know, again, nature knows how to do it. Let's just figure out how to use it in the right ways. In terms of actually increasing the supply of stem cells, the good news is that the science is moving forward every day. And as you probably have heard, and many of us now know, we can take skin cells and make them into stem cells. They're called inducible pluripotent stem cells. Pluripotent, what does that mean? Just means it has a big potential to do a lot of different things. But the way you do that is you turn on all these genes that are the same genes that are present in, quote, cancer cells. So the bottom line is we don't know yet how to control all these things, but we're learning. And 10 years ago, all we knew was cancer cell bad, period. Now we know how to manipulate that and make stem cells out of a skin cell, and you can create a whole
So there could be lessons from cancer cell behavior we could apply to decrease the senescence of other cells in the disease of
the aging. No question. Clinical trials are underway for cell therapy now for a number of different diseases. We do islet cell transplantation today. We didn't used to.
And islets
Islets are the cells in the pancreas that make insulin. So for diabetics, it's possible now to get pig islets or islets from another individual transplanted into your body to produce insulin if your pancreas has failed. There are trials underway for spinal cord injury, and in fact, the first embryonic stem cell trial is now underway for spinal cord injury. Maybe a whole new world of hope out there. Cells, bone marrow cells, umbilical cord blood cells, adult stem cells are all being used to treat cardiovascular disease. So in reality, some of these things are already becoming more and more available. Now, can we build an organ yet for someone who needs it? No. But are we decades away? I don't think so. I think we're years away, not decades away. And if we think about building a piece of an organ, you don't need a whole liver. You might need a lobe of a liver.
Mm-hmm. Sure.
And if
Many
we're
people
talking
get by
about
with just a lobe of a
people
liver.
get by with a lobe of a liver. People get by with part of a kidney.
Right.
We think it's possible to build these incrementally. There are kids who are born with congenital heart disease who would be happy for a patch or for a piece of a heart. And we think that those are even nearer term. So we have to go to the FDA. We have to move the science forward. We have to go to the FDA. You know, I also have a saying, would I want it used on my mom?
Sure.
And if it's not ready to be used on my mom, it's not ready to be used on your mom. But what I can also tell you is I have parents calling me saying, can you help my kid? I have kids calling me saying, can you help my mom or my grandmother or my brother or my sister? And it really puts a name on what you're doing. And if you think you need, you know this far better than I, it's a motivator to get you up out of bed every day and get there and really try to move it forward as safely and as quickly as you can.
I like the mom test.
Yeah.
You know, it's so wonderful to think of people in research applying that standard to what they're doing, the ethical standard. Is it ready to be more benefit than potential risk? Because that's what people ask us in the clinic.
Sure.
If it were your daughter,
Right.
So we all are thinking
Right.
that way.
Before we ever move to a clinical study, we have to show that that the treatment is safe and that it's effective. And the only way to show that it's effective is to transplant those hearts into animals first, and we can have that conversation offline, and show that we can actually cure heart disease. You know, we're doing we have tried to get a really cool study going on at the vet school to actually treat Doberman pinschers that develop heart failure with stem cells. Because we all know there are a lot of people who are very attached to their dogs, and if I could change their world, I'd be happy with that too. But yes, now we've already taken our rat hearts where we've put new cells in and transplanted them into the abdomen of rats, because if you think about it, the first surgery you do, you don't want to have everything riding on that. You want to show that you can hook it up, that it's got the right plumbing, that it stays alive, that it does all the right things. And so Stefan and my group's done a number of those transplants, and those have been pretty promising. So we're about to the point that we're ready to move forward and do the real deal, if you will, and try to keep animals alive.
Yeah, there's so many steps that just simply must occur in order
Right.
for it to pass the mom test, if you will, or
Right.
for us to have any conscience about recommending it to families, because people get desperate, but we've got to know that the benefit to risk ratio is high enough. But there are all these steps. They take debate because we have wonderful breadth and diversity of opinion and experience in this country, in this world. And they take funding. And
they take time, they take money. If you think about it, this is hundreds of billions of cells that's going to go into a kidney. You know, it would take 40 jars this size full of cells because the cells only grow on the outside of the jar in the lab, to grow enough cells to put in this kidney to begin to create a new organ. So we're not talking, right now to make even a small heart costs us about $5,000 to $10,000, you know? We're talking a lot of resources. On the other hand, what's so exciting is every step we use for heart, we can then apply very easily to every other organ. So that $10,000 that we invested in learning how to build a blood supply to a heart now works to build a blood supply to a liver.
But I think it's part of the reason that it's so critically important to be out there. It's tempting never to leave the lab when you've got great discovery going.
Right.
But this is the kind of research, this transformational research requires grand public interest. People have to want resources to go there, want to have those great debates about stem cells and animal research, et cetera.
Well, and you have to be willing to be ahead of the curve.
Yep.
It really takes early adopters, if you will. Yeah. It takes people who are willing to, here we go again, it takes people who are willing to be great and who wanna do it. Yeah. If it were easy, somebody else would have done it.
Think forward. Think Research Channel.